Coronary artery bypass. When one of the heart's arteries is narrowed or obstructed by plaque, blood flow to the heart is reduced. This may cause certain symptoms, including shortness of breath or pain. To re-establish blood flow to the heart and relieve symptoms, doctors may recommend revascularization through a coronary artery bypass. This surgery consists of bypassing the blockage in the artery by creating a bridge to re-establish blood flow. The surgeon may perform this operation with the heart still beating or by temporarily stopping the heart. Your surgeon will decide the appropriate approach depending on the type of surgery required, the level of complexity, and your state of health, and they will discuss this with you. The operation's main steps. General anesthetic. Before putting you under, you'll be hooked up to a cardiac monitor, a device that measures arterial pressure, a pulse oximeter, which measures the oxygen levels in your blood, and intravenous fluids. Then you'll be put under anesthetic. This stops you from feeling pain during the operation. Once you are anesthetized, you will be intubated to help you breathe, and a urinary catheter and some venous access lines will be inserted. The anesthesiologist will monitor you throughout the operation. Opening the sternum, or sternotomy. Most of the time, a sternotomy is performed. This technique consists of cutting your sternum in two, vertically, and spreading the two halves with the ribs. This approach gives the surgeon access to your heart. Beating heart surgery. Your heart continues to beat throughout the surgery. Temporarily stopping the heart, cardiopulmonary bypass. Your heart will be temporarily stopped and connected to a heart-lung machine. This device consists of a pump that does the work of your heart and lungs. Harvesting the venous or arterial line. One or more incisions are made to the leg, the saphenous vein, or arm, radial artery, to take part of a vein or artery, which the surgeon will use for the bypass. The surgeon may also use a mammary artery behind the thorax for the bypass. In this case, once the sternum is open, the base of the artery is detached and reconnected to your heart. Coronary artery bypass. The blood vessel will enable a detour or bridge to be created to bypass the narrowed or obstructed section of your coronary artery. Closing the sternum. At the end of the operation, the two sides of your sternum will be put back in their normal position and attached with steel wires.